Hi, my name is Dr. Larry Zubel. I am an optometrist, and I've been volunteering with RAM since I first met Stan back in 1996. More often now that I'm retired than previously. The inspiration for RAM was seeing what kind of work they're able to do for a huge number of people. It's inspiring to see a whole bunch of people show up at a RAM event, a whole bunch of volunteers show up at a RAM event, and at the end of the day or the end of the weekend, an awful lot of work gets done for an awful lot of people without it really seeming like anybody was overwhelmed. I mean, it's a long day and it's busy, but at the end of the day, you feel good about it as opposed to exhausted. It's very inspiring and encouraging to see that many people donating of themselves for the benefit of folks who need that service. A vision exam is a remarkable thing in what it's able to do for someone who needs it. Someone who doesn't have good vision but has otherwise healthy eyes. I mean, a pair of glasses could mean the difference between being a liability to your family and being a provider for the family. For the cost of a couple of minutes and a couple of bucks, you can take someone who's legally blind and make them be whatever they want to be. I mean, a race car driver, a pilot, whatever you like. It's very, very common for nothing but a pair of glasses to stand between someone who can't function in society and someone who can do anything they want to do in society. It's also kind of nice to get an eye exam and to look for problems that you may not otherwise be aware of. It's obviously very true for folks with diabetes, but there's other conditions such as glaucoma, cataracts, and whatnot that we look for and make referrals for as needed when we find that sort of thing. But the vast majority of folks are simple. They just have healthy eyes, can't see. When we show up at a RAM clinic as a provider, you check in, you get a little name tag like this, and you're shown to where you're going to be set up. The volunteers have typically set everything up the night before, like they have here, and you're given an assignment. Sometimes what you'll be doing if you're a provider is either doing refractions or working on a slit lamp. Other volunteers who are not necessarily doctors are taking acuities, getting an autorefractor to determine a preliminary prescription that you can use as a starting point, taking tensions, eye pressures, and doing a variety of other things ahead of time. By the time you see the patient as the provider, a lot of that stuff is written down. You do your thing, and at the end, you get to tell them their final stop is to go pick out some glasses, and then RAM will make the glasses for them while they wait. It's a really neat setup. They've been doing this for, like I say, what, 40 years? This is the 40th anniversary, right? 40 years and 1,200 missions, is that right? 1,500 missions. So they've got a lot of practice at this. It really runs like a very well-oiled machine. They've got a bunch of volunteers that are assigned pretty much just to make sure people get to where they need to go, answer questions, make sure nobody gets lost, and make sure things roll smoothly. It's almost relaxing while it is so busy from a provider standpoint to do that. I really enjoy it. The equipment that's behind me includes phoropters and projector charts to do refractions. Off to the side over here, we have slit lamps with tonometers on them. Most typically, people will come in, the patients will come in already having an NCT taken, an automated tonometry, an automated pressure reading. But if you want to double check that, we can do that with the slit lamp. And we've got all kinds of diagnostic drops as well, so folks who need to get dilated can get dilated. There's not much limitations on that. RAM provides all that, as well as a BIO, if you're an eye doctor, you know what that is, and the lenses that are used to look inside the eyes. Yeah, I don't bring any of my own equipment at all, on purpose. That way I know that if I leave with any equipment, I've made a mistake. I leave everything here, and it shows up at every RAM event I volunteer at. It's very handy. Most patients who show up are in need of some sort of vision care. A lot of folks have access to some sort of medical insurance, but dental and vision are commonly separate from that. That's a little bit of a hole we're trying to fill. It is really common for folks to come in with glasses that are 6 or 8 years old, or broken, or that they don't have any at all. It is also common for folks to come in with diabetes, and they'll know that they're supposed to have an eye exam every year. They haven't been able to get that done, so they'll beg us, please get me dilated. I know I'm supposed to, but I haven't had access for a couple of years. Once in a while, we'll find folks with a problem that is otherwise would remain hidden. Diabetic retinopathy, yes. Occasionally we find folks with glaucoma. Neither of those things cause any pain, but they'll cause vision loss. Cataracts are not uncommon. Typically the patient knows they have them, or they know something's going on, because that'll cause blur. Once in a blue, we'll find somebody with something that is significantly more serious. We've seen 1 or 2 patients had some swelling of the optic nerve in the back of their eyes, which can mean a variety of things, but one of the things you kind of got to rule out is a brain tumor. So we've sent a couple of people, or arranged for them to get an MRI to get their gorge scanned. It happens. Again, most folks are pretty healthy. Most folks just need glasses, but we're on the lookout for everything else, and it does turn up. The most common reason is a lack of medical insurance. If you've got a medical condition, you can get an eye exam and medical will pay for it. But if you just need vision care, something more routine, you don't have glaucoma, you don't have a cataract, that is typically a separate insurance plan, and not everybody's got that. And for some folks, it's the premium for that is out of reach. It's a hole in the system that we're just trying to fill. One of the things that I admire so much about RAM is not just how many people volunteer of their time, but the way the folks who work for RAM full-time are able to really squeeze a lot of care out of a dollar. They have agreements or negotiations or something with the suppliers of frames and lenses, equipment, the medications that we use for eye, for dental, for medical, for all this stuff, where we can offer a comprehensive eye exam for a whole lot of people in one weekend for a cost that is a little bit difficult to believe. When it's easy enough to pay, $100, $125 for an eye exam, easy to drop $500, $800 on a pair of glasses, RAM is able to deliver hundreds of exams for that cost. It's really remarkable the way they are able to squeeze an awful lot out of a dollar of really high quality stuff. The slit lamps are totally functional. The phoropters are totally functional. Everything we need to do a really good, thorough, comprehensive eye exam is here.